We're back here on Jones and Company, and we are talking about the Zika virus. And hopefully, you would pay attention to Dr. Felicia Greenslade and people like Dr. Glen Beneby, so that we can ward off any attack or effect of the Zika virus or the Aedes aegypti mosquito in the Bahamas. What do we look for in terms of symptoms? I'm in one of the family islands, and I see some mosquitoes, and I am bitten. What do I look for?
Well, the thing with this Zika infection is that it's actually a very mild infection. If you've had any experience with having either dengue or chikungunya, the symptoms are similar, but on a milder scale.
Oh, he had a serious attack of dengue. The old man was in bed for about 3 days, 4 days. I was sorry for him. I sent him juice, I sent him all kinds of things.
Which is excellent, because that's what he would have needed.
And he laughed at me, made sport of me.
Because he's your friend.
Yeah.
But some of the symptoms that you can look for, you look for a low-grade fever or a rash. Basically, you're going to see general flu-like symptoms. So body ache, possibly headache. What people may notice is the average Bahamian would say pink eye, but it's not pink eye. The eye looks a little reddish, but you don't see any of the discharge coming from the eye. And one of the less common things, you might even see swelling of the feet, but it's a mild illness. If the mosquito bites you, you might see the symptoms in about 2 to 7 days, if you see symptoms, because most persons will not. With this particular illness, probably 1 in 4 or 5 persons may actually show symptoms after they've been bitten by an infected mosquito, which is part and parcel of the concern as well, because you may have the infection and not know, simply because you don't get ill. It's a very mild disease. The biggest problem with the Zika virus infection is not the disease itself, but the complications of it.
Yes.
So the complications that you may see if a woman contracts the infection early in her pregnancy, the microcephaly that you would have discussed earlier, and there's also the possibility of developing Guillain-Barré syndrome, which you know is that neurological problem where you basically have paralysis of the muscles. So those are the 2 things that we're most concerned about. We don't have hardcore proof as such that they're connected to the virus, but there's a very strong association, and you don't want to ignore it.
And this is a non-communicable disease, right?
It's vector-borne. It's not person to person at this point. It's a new virus. We're learning more about it. The only human-to-human contact we know right now is vertical, in terms of mother to child in utero.
Okay.
So we know of vertical transmission, so it's human to human in that respect. They're looking at other modes of possible transmission, but for right now, the 2 confirmed modes that we have, by mosquito bite and mother to unborn child. Those are the 2 definitive modes of transmission. And right now, again, they'll change as we learn more about the disease, because we have what we call a case definition. A case definition is what we use to guide our physicians and our healthcare workers in terms of what to look for in a disease. So the symptoms that I called off for you, they form the case definition. And this information is updated as we get more information about the virus, about the disease, and this information is sent out to all the physicians in country on a regular basis. So as we get new information, we disseminate the new information so that everybody's kept up to date. Again, we have the presentations that are going to be ongoing in terms of healthcare providers. We're planning at least 6 more sessions, because we started from last year, just dealing with New Providence alone. But we also have staff who are actually going to the islands, and they're doing presentations to all the islands in terms of, again, what to look for, how to manage it, and how to maintain your monitoring.
Okay. The Aedes aegypti mosquito has been around for a long time, circulating for a long time.
Yes, it has.
Because we've had the dengue epidemic here. And so not all of the Aedes aegypti mosquitoes are carrying the Zika virus.
You only have to worry about the female, as you know, because the female is the only one that bites. The male doesn't bite.
Okay.
But the mosquito has the ability to carry the Zika virus. So which is why we don't want it introduced into the country. Because if someone has a Zika infection and comes here, we already have the mosquito. So if they're bitten by an Aedes aegypti mosquito, then they can transmit it to someone else.
So you have the Aedes aegypti mosquito in country now?
Yes.
But they are not necessarily carrying the Zika virus?
As far as we know, no.
Okay.
Dr. Green said, let me ask you a broader question. Dr. Beneby said that this Zika virus being born by a mosquito goes back as far as 1949.
47.
47.
67 years ago.
Mm-hmm.
All right? And is this disease connected to development?
Urbanization?
It is a disease that is principally in Africa, right? And hasn't reached North America and Europe.
Yes.
In any epidemic proportions, right? Where there is funding to do the necessary research in order to...
It's in Europe.
I
think they've had one case.
One case, in order to protect the
America.
population from developing a vaccine or medications which could combat it. Do you think now that it's in North America, particularly in Florida, there'll be a greater concern for developing medications?
I do believe that is what the thrust of the meeting that the president actually called with NIH. I think their thrust was to get more research done to find out more about the virus and to see if there are any treatment modalities that can be developed.
As long as in Africa, they ain't worried about it.
Oh, Lord.
As long as what is in Uganda.
Yeah,
Yeah, because it's been in Uganda from 47. But once it hits North America and Europe now, we got to spend some money on research.
Research is being done. So right now, we don't know much about the virus. We're trying our best to find out as much about it as we can. So we're doing our best to keep abreast of all this information because it behooves us as a country to know and to be able to put best practice in place for our population. So until that time, everybody treats it as a new disease because that's what it is. We're all naive to it.
But tell me, a place like University Ibadan, which is supposed to be a center for tropical medicine, no work has been done on this there, or Makera in Uganda, or even UWI in the West Indies?
I think what is going to happen now, because it is a global issue now, it's recognized as a global issue, because you only really had it never moved out of Africa until I think that was not even in 2014. It was still on the Western Hemisphere. It never came to the Western Hemisphere until 2014.
It crossed the Atlantic.
It hadn't crossed the Atlantic. And even then, when you did some of your research, it didn't seem as if they ever really got epidemic proportions as such. As mentioned earlier, the Western Hemisphere is pretty naive to it. So it would seem as if we're going to have something explosive going on simply because the populations here are naive to it. But with that in mind, they will be doing research to develop vaccines, to develop treatments as soon as they possibly can, especially given the nature of the potential effects to unborn children.
Or maybe in where it was in Africa, there was some sort of natural immunity, as is the case in sickle cell, where people are naturally immune to.
In some
could that be one explanation?
Again, the population is not naive to it. They've been exposed to it for quite some time. So for them, it shouldn't be an issue as such. But for us, a naive population, it is.
Yeah.
To tell me, as naive as we are with respect to these, to this particular virus, an adult gets the Guillain-Barré syndrome. How is that person treated?
Supportive care.
Just supportive care?
Well, first off, there's a paralysis that you're considering. There's treatment available in terms of immunoglobulins that you can use to help to reverse what's going on. But is mainly supportive as well, and then physiotherapy. Because most persons after some physiotherapy, with some persons within a few months, depending on how severe it was, some may be longer, they regain function. Others, it may not be as simple, depending on how severe the disease was.
But you do have the protocols in place to reverse the
Yes.
disease.
We do have the treatments available.
The treatments are available for the
Guillain-Barré.
Guillain-Barré.
How expensive is the treatment?
Now, I don't know about prices. I cannot answer to prices.
Yes. But we've had none in the Bahamas.
It's been
So, yes?
years.
Yes, we've had one?
We've had them before, but it's been years since we've had a documented case of Guillain-Barré in the Bahamas. It's been years.
And so when we had it in the Bahamas, it came from the same source?
No, Guillain-Barré can occur if you post any viral infection. You get some sort of viral infection.
You get paralysis.
Not so much that you get paralysis. You have what they term a cross reaction, and your body's immune system goes into overdrive and affects the nerves.
Okay, all right. And so you are able to treat that quite successfully in the
We
Bahamas?
can give adequate supportive treatment, yes,
Very good.
and physiotherapy.
Okay.
What kind of doctor are you? What's your specialty?
Public health.
I mean-
Public health.
All right, public health is a broad field, but
Yeah. She just keeping the community healthy.
We're the watchdogs of the community's health.
Yes, and she is working with the Department of Environmental Health to ensure that they are fogging properly. And we are going to hold her to her word that they are doing a very good job in fogging in the islands of
The
the
point- the
Bahamas.
point of- the
And
point of-
we are going to reduce the level of
Breeding sites.
Yeah.
breeding sites in this country.
no. The point I wanted to make
Now,
was
I want to take her on a tour with me as we go about Operation Love Your Country
Yeah.
to see the
Some of this nastiness.
the conditions.
We've seen.
You've seen?
Yes.
You sure you've seen?
Yes, we've seen.
no. Dr. Green said
Okay.
the point I was making was you're a PhD or MD.
I am an MBBS.
Okay, that's what MD.
Okay. Okay. Very good. Thank you so very much, ma'am. You've given us tremendous education today on the Zika virus and what your surveillance program is all about. Thank you so very much. You're coming back, right?
If you'll have me.
Very good. Thank you, Godfrey Eneas.
Thank you.
Thank you for watching and listening to our program. Good evening, everyone.